Hi, my name is Shivani Sharma and I'm a pharmacy candidate of 2021. Today I will be talking about the medication Lisinopril. I will go over patient counseling, how to take this medication and what to expect, and also talk about what this medication is, what it does, and some warnings and precautions people should look out for. So let's start with patient counseling. This medication is primarily used for high blood pressure, but can also be used for heart failure or as an adjunct therapy after a person has a heart attack. Lisinopril comes in a tablet dosage form and is usually taken once a day. Try to take this medication at the same time every day to maximize its efficacy. If you miss a dose, take it as soon as you remember. However, if it is almost time for your next dose, skip the missed dose. Do not double the doses. You want to store this medication at room temperature away from excess heat or moisture. Some side effects people may notice with this medication include a cough, dizziness, or headache. Feeling dizzy or getting a headache will go away as you keep taking the medicine. It is a well-tolerated drug with little side effects. Some people can develop a dry cough while on this medication. Some patients have described it as a tingle in the back of their throat. If this continues to be a problem, talk to your doctor about other alternatives. If you are pregnant or planning on becoming pregnant, have extreme swelling in the head, neck, or have low blood pressure, let your doctor know right away. So a little bit more about Lisinopril. Like I had mentioned before, this medication is primarily used for hypertension. It is also used in acute myocardial infarction and as an adjunct in heart failure. Lisinopril is in a group of medications called angiotensin converting enzyme or ACE inhibitors. We'll get into the mechanism of action here shortly. Some brand names for Lisinopril include Prinavil and Zestril. Lisinopril also comes in a combination form with hydrochlorothiazide for people that need a little more help in lowering their blood pressure. So Lisinopril is an angiotensin converting enzyme inhibitor. It prevents the conversion of angiotensin 1 to angiotensin 2. Angiotensin 2 is a potent vasoconstrictor, so Lisinopril causes less of it to be made, therefore causing a reduction in the vasoconstriction, which ultimately helps decrease the blood pressure. This also causes a reduction in aldosterone secretion, which causes an increase in sodium excretion, which then decreases vascular volume, leading to a decrease in blood pressure. Lisinopril also blocks ACE from degrading bradykinin. Having more bradykinin available in the body leads to more vasodilation, which also reduces blood pressure. Dosing and administration. For hypertension, the initial dose for Lisinopril is 10 milligrams by mouth every day, with a max dose of 40 milligrams a day. For heart failure, the initial dose is 2.5 to 5 milligrams by mouth every day, with a max dose of 80 milligrams a day. For hepatic impairment or renal impairment with a creatinine clearance greater than 30, no dose adjustment is needed. For a creatinine clearance between 10 to 30, we want to reduce the initial dose by 50%. And for a creatinine clearance less than 10, we want to reduce the initial dose to 2.5 milligrams. For a post-myocardial infarction, we want to start with one 5 milligram dose, followed by 5 milligrams by mouth after 24 hours, and then 10 milligrams by mouth after 48 hours, and then continue with 10 milligrams by mouth once daily. If there are no complications, Lisinopril can be stopped after 6 weeks. Lisinopril is a well-tolerated medication with little side effects, but there are a few things we want to watch out for. Some drug-drug interactions we see are with Entresto and phenylcypromine. Concomitant use of Lisinopril with Entresto can increase the risk of angioedema. Also, if you are on Entresto or Lisinopril and switching to the other, there is a 36-hour waiting period, and this is to make sure there is no interaction between the valsartan component of Entresto and Lisinopril, since this may cause hypotension, acute kidney injury, and hyperkalemia. Some other side effects seen with this medication is a dry cough, hypotension, hyperkalemia, and fatigue. So moving on to some warnings and precautions. Lisinopril does have a black box warning for fetal toxicity in pregnancy. When used in pregnancy during the second and third trimesters, ACE inhibitors can cause injury and even death to the developing fetus. It is important to let your doctor know if you are pregnant or planning on becoming pregnant. Some other things we want to watch out for are patients who have elevated potassium levels and patients who exhibit hyponatremia or hypovolemia. It is also less effective in lowering blood pressure in Black patients. Some contraindications include hypersensitivity to this medication and if a patient has history of angioedema. Some monitoring parameters we want to watch for are blood pressure, serum creatinine, serum potassium, and serum sodium. These are my references, and thank you for listening to my presentation.